Significance of mature abnormal vessels in the treatment of wet AMD, with commentary by Mark S. Hughes, MD. In neovascular age-related macular degeneration, or wet AMD, the major pathologic feature is choroidal neovascularization. Abnormal vessels arising from the choriocapillaris have invaded Bruch's membrane and occupy the subretinal space. These leaky vessels are responsible for edema, hemorrhage, and subsequent retinal damage and scarring.
In this first image of the fluorescein angiogram, what you see in the early AV transit phase is an area of lacy hypofluorescence, which represents the leakage from the abnormal vessels from macular degeneration. As we progress to the second image, you'll see in the mid-phases continued leakage in the subfoveal space from these abnormal vessels. And finally, in the last image of the fluorescein angiogram, you'll see this pooling of the fluorescein in the subfoveal space. This is a very nice example of a classic choroidal neovascular membrane in age-related macular degeneration. High-speed indocyanine green, or ICG, video angiography is an excellent technique for demonstrating blood flow and vascular morphology in choroidal neovascularization. In this example from a patient with neovascular AMD and classic CNV, what we see is many large caliber mature vessels, including a feeder artery with multiple branching arterioles.
In wet AMD, there is abnormal increased production of growth factors, including VEGF, which induce the formation of endothelial tubes. These endothelial sprouts can be particularly dependent on VEGF and other factors for growth and development. Inhibition of these factors may reduce endothelial tube formation and leakage and result in clinical improvement. However, if the nascent blood vessels continue to develop, they are influenced by additional growth factors which recruit pericyte precursors. These cells develop into mature pericytes, which envelop and stabilize the endothelial tubes, facilitating vessel maturation. Additionally, the developing vessels produce a new basement membrane, which further stabilizes the neovasculature. With maturation, the vessels become progressively less dependent on VEGF and other biochemical factors and may be relatively resistant to growth factor inhibition. These established abnormal vessels may be responsible for continued disease progression.
Following inhibition of biochemical factors, you'll note on this fluorescein angiogram there is still evidence of leakage. You'll note the irregular punctate hypofluorescence with an ooze pattern in the late frames. In this high-speed ICG video, large caliber mature vessels remain patent despite inhibition of biochemical factors. It may well be that these complexes of abnormal vessels under the retina are less dependent upon VEGF and other biochemical growth factors.
Photodynamic therapy, PDT, that selectively occludes the established abnormal blood vessels may reduce vessel leakage, edema, and hemorrhage, and help slow disease progression.
In this treatment-naive patient, we have a fluorescein which exhibits a predominantly classic choroidal neovascular membrane. Following angio-occlusive therapy with PDT, there is no longer any evidence of leakage. There is staining of the RPE without evidence of recurrent disease activity. Therapy that selectively targets established abnormal vasculature can help protect vision against the natural disease progression and has a definite role in the modern treatment paradigm for wet AMD.
Visudyne is indicated for the treatment of predominantly classic subfoveal choroidal neovascularization due to age-related macular degeneration, pathologic myopia, or presumed ocular histoplasmosis. Important safety information. Visudyne is contraindicated for patients with porphyria or known hypersensitivity to any component of Visudyne. Infusion-related transient back pain occurred with Visudyne only. Verteporfin infusion induces temporary photosensitivity. Patients should avoid exposure of skin and eyes to direct sunlight or bright indoor light for 5 days. To prevent extravasation, avoid fragile hand veins in favor of larger antecubital veins. Severe vision decrease greater than or equal to 4 lines was reported within 7 days in 1% to 5% of patients. Partial recovery occurs in some patients. Do not retreat these patients until vision completely recovers to pretreatment levels and potential benefits and risks of subsequent treatment are carefully weighed. The most frequently reported adverse events, 10% to 30% incidence, were injection site reactions, including extravasation and rashes, blurred vision, decreased visual acuity, and visual field defects. Please see accompanying full prescribing information.